I'm Andrew Benton. I'm a family medicine doctor with Franciscan Physician Network. So I decided to become a family medicine doctor while I was in medical school. So every month or so we have different rotations and different specialties, and I found myself that even if I wouldn't like the entire field of whatever I was doing that month, I would like little bits and pieces of it, and family medicine was a great way to incorporate all of that. As a family medicine doctor, I'm passionate about improving the lives of my patients. I legitimately want all my patients to leave the visit that day thinking that we have addressed whatever was important to them, regardless of what the schedule said they were there for. So I was the first one in my family to pursue medicine. So before me, there wasn't anybody else in my family that was a nurse or a doctor or really anything in the health field. When I was in high school, my mom became ill and she was waiting to get a lung transplant. Unfortunately, she passed away before she was able to get that. So that's kind of what inspired me to pursue medicine at that point. I chose to practice medicine at Franciscan Health because of the people here. The people have been incredible. Just from day one, the application process, the onboarding, everybody in my office, and that includes practice managers, the other providers, even the engineering staff that's been by, they've all been excellent. Couldn't be better to work with. One of the things that I think sets us apart at Franciscan is some of our technology. So we have Epic medical record system, which is one of the best medical record systems around. Epic allows me to do things in seconds that would take several minutes or longer with some of the other medical record systems that I've used at other places. Also, we have a great patient-facing part of that called MyChart, which allows patients to get on there and remotely view their lab results. They can set up appointments, they can send messages, and it can be a really good resource that patients have something written to look at instead of having to wait for an office staff call. So I think that's a really good thing about Franciscan. When I'm not in the office practicing medicine, I enjoy traveling with my family, basketball, cycling, swimming. Those are some of my favorite activities. Something that I really want my patients to know, I think if they're looking for a doctor to be a partner in their health and talk about what some of the options are, why they might be a good option, why they might not be a good option, and come to a decision together, then I think we can make a good improvement in your health.